Fortunately, there's a fairly easy way to determine, at least begin to determine, if someone has a cutaneous infection or cutaneous mycoses with a dermatophyte. Many of the dermatophytes will glow in the presence of ultraviolet light. So you simply need to use a black light, or what's often called a woods lamp. Turn out the light, turn on the woods lamp, and shine it on the affected area, because typically cutaneous mycoses at the very least are going to itch, or if they're on the scalp, will cause hair to fall out. Notice in the photo at the bottom, you can almost barely make out the long filaments growing on the hair shaft. In the presence of the UV light, they tend to glow. If you see that glow under the illumination of the woods lamp, then you for sure have a dermatophyte infection, and then you can proceed to treat accordingly. If it doesn't glow, it doesn't mean you completely eliminate the possibility that's a dermatophyte. Not all species of dermatophytes will glow in the presence of UV light, but enough of them do that you at least can begin to determine if, in fact, you have a fungal infection of the skin or the hair or the nails. If that doesn't work, then we would simply use a KOH prep. KOH, or potassium hydroxide, at 40%. We would take a clipping of the hair, scraping from the skin, or a bit of fingernail, immerse it on a microscope slide in a little drop of 40% potassium hydroxide, put a cover slip on top, and then look through the microscope. The 40% potassium hydroxide will dissolve the keratin in the nails, skin, or hair, but will not affect any of the fungal elements. So if there are any conidia, if there are any hyphae, we're going to be able to see it on the KOH prep. That too will help us determine what's causing the different kinds of symptoms in our patients. Another genus in the phylum Deuteromycetes that's of clinical and industrial or manufacturing importance is the genus Penicillium. In the 1920s, Alexander Fleming discovered penicillin being produced by Penicillium notatum. Now, it was not a tremendous producer of this antibiotic, and in fact, a worldwide search was undertaken to discover different species or strains of penicillium that produced even more penicillin than the original. And in essentially the 1940s, on a cantaloupe in Peoria, Illinois, a housewife had discovered a mold growing on one of her melons, her cantaloupes, and she sent it in to the researchers in the pharmaceutical company. Penicillium chrysogenum is now the most likely species being used because it produces far greater amounts of penicillin than the original Penicillium notatum. In any case, penicillin, of course, has been both historically and commercially, and in terms of medical treatment, a very valuable source of medication to treat various kinds of bacterial infections, all from a product from a mold, penicillium. Another genus in the Deuteromycetes that's of commercial importance and medical significance is Aspergillus. The species Aspergillus fumigatus is actually a mold that can grow on peanuts or corn. Now, unfortunately, Aspergillus, it reproduces by asexual conidia, those little spheres and long chains. But Aspergillus fumigatus produces a chemical called an aflatoxin. The aflatoxin essentially causes an alteration in the growth and function of eukaryotic cells in animals. In fact, it modifies and transforms these cells so much that it even can cause these cells to turn into tumors or cancers. So we identify the aflatoxin as a carcinogen, and there are departments within the FDA, the Food and Drug Administration, that constantly monitor our peanut and corn food products for the presence of Aspergillus fumigatus itself and the aflatoxin in the food. We want to protect ourselves from this cancer-causing agent.